Hello everyone, so this is Dr. Nirmal Nayak, and I know after a long time I am again starting my YouTube channel. So this is our first podcast after 2 years. Wait, like we have the students from the India, especially my juniors, they are like why it's like that, how to get in MPH, is good or not, what are the scope after the MPH, then yeah. Today we have the exceptional guest Dr. Karl Minges over here. So let me introduce him. Welcome, doctor, over here. Like he is the associate professor and the associate dean of the research in the University of New Haven. Also, he has founded the Master Public Health course in University of New Haven in the year of 2019. Also, he has a PhD scholar. He has done his PhD from the Ivy League Yale University in the year of 2016. Also, with the from MPH, he has done from the Columbia in 2010. Yeah, so welcome, Dr. Professor, again over here. So basic from the dentistry, from the physiotherapy, pharmacy, nursing, and also from the medical background, students are coming over here in the United States with the mindset that should we get in the MPH or MHA. So actually, basically they don't know the difference between them, but it's just related to the public health and the medical background. So that's why they are taking that. So my first question is like that: would you please elaborate what is the MPH and the difference between MPH and MHA?
Sure. So first of all, thank you for having me.
Yeah, always.
Happy to always be here to talk to prospective students. So the difference between MPH and MHA they're pretty significant differences. Before going into there, let me give a quick introduction to what the MPH is. So it's in general, a master's in public health is a non-clinical degree. However, lots of clinical people get it to supplement. The best way to think about public health is that it's from a 30,000 foot viewpoint, as opposed to, depending on our height, 5 or 6 foot viewpoint. That's how it is with a clinician, right? Public health, we're looking at the individual perspective all the way up onto policy. So we're talking about communities, we're talking about political ramifications, and we're also thinking about a variety of unseen things that can relate to health status. So the social determinants of health is what we call those. So how race, gender, age all affect health status, as well as where you live, who represents you in Congress, and all the way up to how federal policies and laws impact the livelihood of U.S. citizens. But really, the perspective and point of public health is to prevent disease, promote health, promote the safety of society, and to provide health access to others. So public health is really an unseen force because it's not at the one-on-one level.
Yeah, it's not
we create policies, community-based programs. We do research ensuring that people receive equitable care. So the perspective of public health and someone who's attracted to it is someone who wants to be, have you ever heard of the phrase jack of all trades?
Yeah.
So a jack of all trades, or Jill of all trades,
Always,
is how a lot of people get into public health, because you learn aspects about project coordination, project management, analytics.
It's a framework basically.
A wide variety of skill sets that could be applicable to almost any job. So that's why I think public health folks are so marketable, because they have a great deal of skill sets that they learn throughout public health education that can then be translated to the job, which I'm sure we'll talk about later. But
sure.
So going into some differences between MPH and MHA, so in many parts of the country, and including where I did my MPH, healthcare administration actually fell under MPH.
Yeah, actually it's like that. That's even I have seen in the United States.
Yeah. So public health is like the umbrella, and then underneath of it are all kinds of subdisciplines. So, you have health administration and policy, you have biostatistics, epidemiology, environmental health, community health. Some programs even isolate further to maternal child health, to more of a law and policy type of work. So there's differences between the schools in terms of how they approach the MPH. Here at the University of New Haven, it's predominantly a generalized MPH.
Yeah, we have generalized MPH. Yeah, we are having the additional certification course also.
That's right, right. So I created the certifications probably 2 or 3 years ago to give students an ability to upskill in a certain area. For no extra time or cost, if you plan it right, folks can get a certificate in, epidemiology, global health. You could get health informatics as well, and and health promotion. And so that could give you kind of an angle towards getting a job in one of those spaces afterwards.
So they can identify the different aspect like in which they are good and they can go over there. Yeah. Because so many people, we also have that question like students wants to know which one they can take. Like in India there is, it's like a myth. Either you have to go for the epidemiology or for the biostat. So someone who thinks like I am good at mathematics, they just choose the biostatistics over the epidemiology. They don't understand it's just correlated. And even students don't know before coming over here, they even don't know how many branches we have in the Master of Public Health. So would you please tell us about that?
Yeah. And let me talk quickly about the difference between MPH and MHA.
Sure.
So I started off that way, but really at UNH we have a difference, right? We have MPH, but we also have the Master of Healthcare Administration. And like I said, in other schools, sometimes healthcare administration falls under the umbrella of public health, so it's structurally different. But here in MHA is really geared for someone who's really interested in perhaps running a medical practice one day, doing the administrative tasks of that. So the financials, the budgeting, the strategy and innovation, those are all, components of public health as well, but really working within either, long-term care, short-term care, acute care, post-operative care, whatever the area is, someone would be well suited for an MHA degree, because it allows one to focus a little bit more on working specifically in the hospital or outpatient sector.
Administration, we can say, because some students, they think like, we want to do MBA after medical or dentistry or like that, so they choose MHA rather than the MBA.
Correct. Yeah. So that's a good point. An MBA is useful, but it's not rooted directly in healthcare. It's general business. So it can certainly be helpful for someone who's looking to get into the administrative practice of healthcare, especially if you're a clinician or you've worked in this space for a while. But the case and the use examples that are provided are not healthcare oriented. And so the MHA program gives you sort of those clear and concise courses that you need to be successful in healthcare administration, in running a hospital, and working in a clinic, and basically translating some of your clinical skills to more business oriented skills.
They know the clinical aspect they have already seen in the India, and now they can use that in the administration.
Yeah, that's right. Yeah. And what was your question too about the MPH? What were you curious about?
Yeah, so it was like the branches of the MPH. Yeah, they don't know about any other, like rather than they just know epidemiology and the biostatistics.
Yeah, so I think that there's what's beautiful about Masters in Public Health and public health in general is that there are so many opportunities for you to engage in a variety of programs and areas that you're interested in and that your skill sets are in. If you don't like analytics, if you do not like math, if you don't like statistics, if you perform poorly in those areas, well, maybe that's not your strength. But maybe you're a really good writer. Maybe you're a really good communicator. Maybe you're very good about conceptualizing or organizing things. Maybe you're really interested in advocacy and fighting for the little guy who doesn't have the voice. Maybe your skill set is in clinical regulation or regulatory affairs, or thinking about environmental health issues. So there are so many options besides biostats and epidemiology for folks to go into in public health. Of course, epidemiology is the sexy public health version of a discipline within public health, and it's been seen as that for a long time, because they're the disease detectives. They're the ones who are trying to understand what the cause and effects of disease are. It's tremendously important, especially since COVID.
Since COVID, actually, it was very important in the COVID era. After that, people get to know that there is a branch like.
They get to know what it is, And if you talk to But if you talk to the general audience, they'll think it's dermatology because they hear
Yeah.
epidermis and they think of skin. But you know, I think that if you are very math minded and analytical, biostatistics is an extremely in need field where you could really, I think, connect to make significant career inroads if it's an area of interest to you. But the difference between, you know, epi and biostats, they're big differences, right? But, and for epidemiology, it's a lot about tracking, but it's also in surveillance. But a lot of it's about communication, about assembling partners, about communicating health messages, like for infectious disease outbreak, and then also being sort of that hub and spokes model, being the hub a little bit in terms of an emergency response. So there's lots of things that can be done within epidemiology that are not sort of quantitative. However, you know, a good bulk of one's day is spent, you know, using analytic programs and analyzing data that are available. The other fun thing about epidemiology is you get to be creative, right? So it's about thinking about the intervention, the communication around that intervention, be it, you know, a recall if it's like a listeria on lettuce, let's say, or if it needs to be in you know, a public health sense, how do we collect more data, for example, around COVID outbreaks, things of that nature.
And actually in India, you know, we need a public health people because we have so many medical professionals over here. But you will wonder, like in India, I think there are 7 to 8 universities having the master public health course. Reputed university,
Okay.
And government recognizes like a 2 or 3. One is in Gandhinagar and one is in Delhi.
Okay.
It's like that. So yeah, people in India.
So it's getting traction as a field?
It's like that. In India, we have so many population over there.
Right.
So we need a more clinical person rather than the researchers. That's why in India, only the academic person, we can say the professor or the postgraduate student, they are the only people they are involved in the research.
Okay.
Yeah, just because of the curriculum by the medical council and the dental council. Otherwise, otherwise we don't have a research craze over there.
Got it.
Especially in the medical field.
Yeah, I mean, and a lot of it's because our government sponsors,
that,
you know, through the CDC and the NIH, these are the 2 big institutes that fund the vast bulk of research that's done in the United States. But, you know, I think today, so far, we've really only talked about working in public health itself, but there is, of course, a research track that anyone could go down, be it epidemiology, biostatistics, community health. There's a lot of options. But what's really nice, and I want to bring it back to this about public health, is that, you know, folks can really, like I said, harness their strengths, strengthen those areas that they're weak in, and to kind of do what interests them. Work with populations that interest them. Maybe someone comes to public health because, you know, their grandmother died of cancer, or maybe someone comes to public health because their cousin was shot on the streets. Maybe someone comes to public health because, you know, they saw the COVID epidemic and they want to do something to prevent that from ever happening again. So people have different perspectives for getting into the field, and thinking about what you're passionate about right away is a good way to get into the space. And then think about, do you like the social determinants of health? Is that what you want to focus on? Do you want to focus on epidemiology, biostats, you know, environmental health? Do you want to think about law and policy? Do you want to think about healthcare administration? What areas of public health resonate the most with you? It's not something that I advise most students to be completely convinced that that's the only route. And the reason why is because in your first year, you know, you take a lot of general classes that kind of help you to figure out which area you're best suited for. And there's great books out that we have, and one that I always put in our library for our students to check out for free if they're interested, focused on careers in public health. So there's 101 careers, and they can just go there and flip through the book to see, like, what's, you know, what are the job openings, what's the salary range, but very importantly, what are the job duties, what are the skill sets that are required, all of those things as well.
So that's what I'm going to ask you after this question.
What's the say that again?
Which are the scopes, like in which field they can work, how much they can earn, like that. Because people are coming from the India on the student visa, you know. So we people only have 3 years of the post-study work permit, so they're always crazy. Oh, is there any research in the public health like that? Like recently, we can say in the IT sector, so many people, fired from the companies, from the multinational companies. So they are still worried. Also in the healthcare, is like that or not?
Yeah, so I think first of all, our Master Public Health program is STEM designated. This is something I instituted, I think in 2020 perhaps. And what's valuable about that is it allows, of course, the student to stay for 3 years.
Yeah.
If I'm an employer, I'd rather hire someone for 3 years as opposed to 1 year, right? So the benefit there is clear. And also, it is a STEM field. You know, we have epidemiology, we have biostatistics. These are clearly STEM disciplines. And math is used, and those principles are used in pretty much every single class that's offered in one way or another. Health analytics too, right? As another.
Yeah, also true.
And so when thinking about career options and where to go, it's very interesting. If you Google the term public health and Indeed.com, which is what we use for job searching and internships and things like that, within a 100-mile radius, which includes New York City, probably 3 out of 4 of the positions are going to be something like project manager, project coordinator, program manager, program coordinator, right? They're going to have very sort of plain titles. And what that says is that, you know, in public health, you get the funding, but you need someone to run the program. You need someone to actually go out into the community, to do the surveys, to administer whatever the program was intended to do. So public health is, you know, it's rare that, you know, that you would see a majority of epidemiologist positions available or biostatistics positions available. They exist, of course, but so much of public health is funded by the public sector in the United States that naturally you need someone to actually do the project. So typically, you know, a state, a nonprofit organization, a local town, they'll get the funding from a public health entity from the state or the federal government. And then once that funding is in place, then someone needs to do the health education surrounding it, or to do the, you know, sort of data collection from environmental health, or whatever the situation might be. And for that reason, it's really hard to give a sense of what the salary potential is for a given area. It's been a while since I've looked, because I haven't been in the MPH director role for a bit, but you know, I want to say it generally starts out between probably around 60 to 75,000 US for a position. Perhaps a little bit lower if it's in a field like health education, which is typically grant funded, and those salaries are a little bit lower. But overall, you know, someone can do a very altruistic career in public health, and also be able to earn an income and live, which is nice. So you're making a difference, but also doing so comfortably.
Yeah. So you must have like you have to identify your interest. You have to go through all the branches. You have to see which are the scopes for that. Actually, in each like global health, epidemiology, biostat, okay. So you have to go through across all of them, and you have to find it out. Each and every aspect, what they have, the content, basic. So you will get to know more about yourself, and then after you have to jump into the MPH or MHA. Okay. So people from the medical background, dentistry background, I have told you already. So they are more into the clinical. So they are like, for MPH admission or for the career further into MPH, do they require the research background? Like I have been working as a peer reviewer in so many index journals. So like that was a different thing, because I was working as a lecturer for a year. But students are directly just completing their graduation. They are directly just within 6 months they are coming to United States. So they are like, we don't have any research, so they are just afraid of that. People having the research, or they must have these kind of thing. Then after they will get a job or internship like that. So is that required or not?
No, it's not. I can guarantee you it's not. I had so many colleagues who, you know, I went to get my MPH with, and I went to a big school. You know, Columbia has hundreds of students in each class. And it was rare that someone did research. So, but what they did do is they did internships, they did volunteer experiences, they took leadership roles within the university. They did other ways of upskilling to show their ability to work in a given area. Research is effective if you want to get an MPH, a PhD, or a doctor of public health. if that's your end goal, then of course you need some research background to show that you can be successful. So either getting that at home or during your MPH experience are options. But yeah, it is a misnomer that that you must do research, because so many of our students have been successful in getting jobs based off of internships they've had, or through connections that they've been able to make through their internships and through their circles. We've also had a lot of students who haven't done research that have gone on to residency.
Yeah, that's
in
right.
medical
I think
school.
Dr. Pradeep also have got in the Yale University, I think so.
Yeah, but his is a research job,
Research
right?
job.
So he's working on an NIH grant. So his is very much research funded. So to get in the door there, you know, I worked closely with him as a research assistant for me, for example, and he was able to parlay that into a position at Yale. But you know, we have another student that I just found out at graduation, actually, that he was accepted to residency.
Oh.
And he's going to be going to Louisiana for internal medicine residency.
Internal medicine, yeah, because so many from the MBBS and the dental background, so they also want to do the residency over here, yeah.
Yeah, right. It's harder for dentists, I understand, but
Yeah, I know.
for those with MBBS degrees, it is translatable, and we've had students be successful. And what's nice about it is they'll study for the USMLEs while they're doing their
Yeah.
coursework here. And in those circumstances, I asked him, I said, so tell me, like, did they care about your MPH? And he said, absolutely. That's what helped get me this position.
Position, yeah.
Because they know that they want someone who understands population health and the intricacies of the US healthcare system.
Yeah.
And you get that through doing an MPH in the United States.
Yeah. So to get a residency over here, also you need to understand the US healthcare system, because in India we have a totally different system, and over here it's a drastic change, you know. So people when come over here, they will get to know, oh my God, it's like that only, because here population is less and the technology and the advances are more. In
Right.
India also we have, but at the same time we have a big population, so it's hard to manage at the same time.
Yeah, they're so different. They're apples and oranges, yeah.
Yeah. So my next question will be the same as the last one. Like, is data coding or like that is necessary, and for to get in biostatistic or like that, or they can just come out here, they can take this course and they can go more into that, and then after they will learn that. So
Yeah, I think there's like, first of all, I think there's a lot of online tools that could teach you things like R, SPSS, or Stata, or SAS, which are the common public health analytic frames, or analytic programs that we use, software. But they can also get that through courses, right? So in biostats, I think they're shifting to using more of an SPSS framework to orient like the analytic component of that class. We have health analytics, which teaches you R. So there's coursework surrounding that. But I think that, you know, LinkedIn Learning, Coursera, those are all good sources too. Of course, the best thing to do is to be able to download a publicly available data set and try doing it on your own. You know, that's something I never see students do. I don't know why, right?
it's like practice.
Yeah, the practice.
The more
yeah.
you do, the more you learn.
Right. It doesn't have to be couched with a class. You can do this on your own.
Exactly. People think like if there's getting like a research assistant, then he will get to know. Obviously, he will get to know more about this, but yeah.
Yes and no, because you're dependent on what the principal investigator needs, right?
Yeah.
So like, if you haven't collected the data you need, then you may just be out there doing data collection. You may not ever do analysis.
Yeah.
So it depends on the stage of the project as well.
Which role you are getting, yeah. So almost he has covered all the things over here. And so for the last, is there any tips for the international student? They are coming over here for MPH by your side. It's like which can be good for them in the future for the public health aspects.
What can be good for them?
Like for getting a job or to identify their roles in general, I can say.
Like after they graduate? Yeah, so after graduating, you know, I don't know honestly what the international student experience is as much as I'm aware of the domestic, having been there before, right? But from what I know, you know, it's about the relationships you make, trying hard, getting your name out there, doing leadership experiences. And the biggest faux pas I see is sometimes written communication being like emails that are not professional, or that, you know, there's not correct punctuation used, that are very quick. In the US, that's not the culture. You have to be very, very, very professional. You know, you can't hand in things a day late. Like that's not accepted, right? So changing some of those cultural norms is important. and maybe just understanding them more so, right?
Yeah.
And doing what you can to succeed. You know, we want you to be great students, and I think our program helps to get you there. But we also want you to be good stewards of our program and show the world your potential that you've gained. So that's where professionalism is essential, and you know, where thinking about the networks that you've gained during the program are helpful for what comes next. And another advice I always give students is to think outside of the box. Everyone is limited to the New York, Connecticut, New Jersey area. Yes, there's a ton of healthcare, there's a lot of pharmaceutical companies, there's a lot of public health programs going on in these states, but they're also densely populated, which means that there's more competition from a workforce perspective.
Yeah, so we can go for Texas or like that.
Even Texas is tough, but like think outside the box, right? Like, how about Alaska? How about Idaho? How about Washington? Like, there's so many places where you could consider, and even California is really expensive for people to live in. So like, there may not be the same kind of workforce opportunities, or there may be more workforce opportunities for students. You know, and then you know, to intern, to work with our career development center, to get a resume that's sharp, get a cover letter that's sharp, organize each cover letter by the job opening, because so much AI is used to kind of understand it, and recruit people. And so, you know, and attend conferences, that's important as well, to get to know folks who are in this field. There are professional conferences like the Connecticut Public Health Association, then there's more like research conferences like the American Public Health Association. So depending on what your area of interest is, that's a good way to go. But I do think, you know, students who try very hard to get a position can be quite fortunate in getting one. The other thing that's incumbent upon the student is to teach them the intricacies of, to teach the employer the intricacies of how to get a job, and that employer can indeed employ an OPT student by literally just signing a letter. Many of them think that this is H-1B, so they're like, so the smaller organizations are a little bit confused because they feel like, oh, well, I can't afford a lawyer to sponsor you for an H-1B, but you don't need that for OPT. It's just a simple endorsement letter from UIS. So it's something that sometimes the employer also needs to be educated on understanding how to employ you.
Actually, it's the same thing. You should know your company also. That's the main thing for a job, So almost we have covered all the question basic, and if you have any more question, you can email me, and for sure, just comment us like which kind of things you need in the future. We will make a video on that too. So thank you, Dr. Minges, for coming over here.
Appreciate it.
And you are so awesome, You have done,
you
have done so many things for the students. Actually, they know for the basic. So have a nice day. All the best for the future.